Artificial intelligence, or AI, is a broadening technology. It is quite easily accessible to anyone. When we search for a question, we may get an AI generated answer. Controversy arose when students were using it to write papers for them. Even Snapchat gives us an AI pal. Artificial intelligence is currently being developed for healthcare. Healthcare is largely run on technology, so it only makes sense that AI is being used. This is a big deal because it affects everybody: healthcare workers and patients. Artificial intelligence is currently taking over jobs, leading people to wonder, can AI replace doctors? The answer to this question is complicated, as many factors influence this decision. However, I believe that this is not likely to happen. AI would be better developed as a diagnostic imaging tool rather than to replace doctors. There are a few leading reasons why artificial intelligence cannot replace doctors. The most significant reason for this is that AI takes away from the interpersonal relationship that is needed between patients and doctors. Patients are often scared while receiving treatments. They fear pain or even death. They need to have trust in their healthcare provider. Can trust truly be formed between a person and a machine? 60% of United States adults said that they would be uncomfortable with their healthcare provider using artificial intelligence in a survey in 2022. If people struggle to trust their doctor using artificial intelligence programs as a tool, it is fair to say that people would struggle to trust artificial intelligence without the doctor component. Who's to even say that artificial intelligence could perform all the same tasks as doctors? Perhaps some, but definitely not all. Another issue is that artificial intelligence is also trained by humans. That means it is susceptible in preserving racial, gender-based, and age-related biases. According to a Stanford article, Google Technical Program Manager Donald Martin noted that many datasets are drawn from largely white Northern Europeans or by flawed assumptions written into the algorithm's decision-making processes. With artificial intelligence, algorithms must be developed to reduce these biases. AI would have to be as dynamic as possible to provide proper treatment plans to diverse patients. Biases could lead to incorrect treatments for those outside the algorithm spectrum, which could be harmful. Lastly, artificial intelligence replacing doctors could take away so many jobs. AI is cheaper than paying doctors, which supports the replacement of doctors. Currently, one typical commercial AI software costs around $47,868 US for one hospital for 1 year in the United Kingdom, equivalent to about a third of a hospital consultant's salary. Those who become doctors dedicate themselves to a life of non-stop studying, and they spend hundreds of thousands of dollars to get where they are. How could anyone take away that hard work from someone? Their life's purpose is to take care of us, so why shouldn't we honor that? Perhaps if artificial intelligence is integrated, even as a tool, doctors could be less valued as employees. But that wouldn't compare to taking away their entire career. According to David Dranove and Craig Garthwaite, because physicians play such a central role, they often capture a large portion of the value in the form of very high salaries. If AI took over diagnosis and treatment decisions, one might expect doctors to become less valued and for their wages to sink accordingly. However, they also ask, on the other hand, might doctors end up receiving higher salaries if they can issue faster or more accurate medical decisions with AI's help? When it comes to integrating artificial intelligence as a tool, there is no clear answer as to what will happen to the salaries of doctors. But what is clear is that thousands of people could lose their jobs if AI is to replace them. Despite all this, artificial intelligence has great potential in healthcare, especially in diagnostic imaging. As a tool, many of these previously mentioned issues can be avoided. AI is very efficient at its job. In radiology, AI tools have already been shown to outperform human radiologists both in speed and in accuracy on specific tasks like identifying malignancies on breast imaging. This would ultimately help decrease the workload of doctors, which could be beneficial as the population increases and demand becomes higher. Respectively, the workload demands on radiologists interpreting cross-sectional images have grown markedly over the last decade, with one study showing that the average radiologist interprets one image every 3 to 4 seconds during the 8-hour workday. AI has also shown high accuracy for diagnosing cancer through diagnostic images and decent accuracy for diagnosing strokes. In the journal, The Role of Artificial Intelligence in Early Cancer Diagnosis, there are statistics on how precisely artificial intelligence diagnoses different cancers. The authors use a medical measurement scale called AUC to characterize the accuracy of artificial intelligence diagnoses. AUC represents how accurate a diagnostic test is on a number scale from 0.0 to 1.0, 1.0 being a perfect score. Artificial intelligence's ability to diagnose breast cancer had an AUC of 0.95, diagnosing lung cancer had an AUC of 0.93, and diagnosing brain cancer had an accuracy of 98%. As for strokes, it is critical to quickly identify what type of stroke a patient is experiencing. This is primarily done through analyzing diagnostic images. 3 types of strokes can be identified. There are ischemic strokes, which are strokes caused by blood clots. Hemorrhage strokes are strokes caused by a blood vessel bursting in the brain. And then there are mimic strokes. These strokes must be treated through different methods. One of the primary issues is that blood clots are treated with blood thinners, which will cause a person to bleed more if they have a ruptured blood vessel. The fact is, if a doctor treats a stroke patient incorrectly, the patient will pass away or at the very least be severely affected. A journal by Wardall et al. Reviews multiple studies regarding AI diagnosis of ischemic strokes. In each study reviewed, at least 44% of patients with ischemic strokes were accurately diagnosed by AI, which is a pretty decent number. For those who did not have ischemic strokes, at least 57% of patients would be accurately diagnosed in each study. 83% of patients with large vessel occlusions or blockages were always accurately diagnosed in every study. 90% of patients without these occlusions were always accurately diagnosed in every study as well. There is room for improvement here, especially for the detection of ischemic strokes, but every technology has a developmental period before it is perfected. It shows that there can be even better potential if advanced properly. Ultimately, artificial intelligence could be an incredible advancement in healthcare if used correctly. It already shows promising results, even if they're not optimal results. AI shouldn't be developed to replace doctors, it should be developed to help doctors and patients. Artificial intelligence, despite how intelligent it may be, cannot replicate human connection, which is needed for quality care. It would also need an incredible amount of development and testing before it could ever replace doctors. Using AI as a diagnostic tool is much more ethical and logical. Artificial intelligence can revolutionize healthcare with its speed and accuracy, but as it finds its way into the world, we need to do whatever we can to ensure a better tomorrow. Thank you for watching.